Today, we have with us eminent endocrinologists who can help us understand and manage osteoporosis. Dr. Lakshmi Nagendra, who is an assistant professor at the Department of Endocrinology at K.S. Hekde Medical Academy in Mangalore. Dr. Yogesh Yadav, who is a consultant endocrinology at Max Super Speciality Hospital, Dehradun. Dr. Hridish Narayan Chakravarti, who is the DM Endocrinology and senior consultant endocrinologist at Narayana Super Speciality Hospital in Howrah. Thank you very much, doctors, for joining us on this discussion. Dorothy, while osteoporosis is most common in older people, it sometimes affects young people as well. Why does it really occur in young adults?
The myth is actually that osteoporosis is a disease of old age. But what we need to remember is that it can also occur in the young population, the adolescents, and especially in the most productive age group, that is 30 to 50. So they are relatively young people who are getting crippled by this disease. Now, what we need to understand, when this occurs at a younger age of onset, certain diseases have to be considered in particular. Dr. Yogesh had just mentioned, I would just draw an extension to what he said, that rampant use of steroids, what we saw during the corona pandemic, that causes rapid bone loss, and we saw a lot of people in young patients who suffered because of corona recovered, but because the steroid had been given, they landed up in osteoporosis. The other endocrine issues which concerns me as well as the other panelists being endocrinologists is that there are some other disorders of glands, as Dr. Lakshmi was mentioning, that we can have diseases in thyroid like hyperthyroidism, when the thyroid gland is functioning more, releasing more hormones. In those circumstances, osteoporosis may occur. Then parathyroid diseases, that's also a small 4 sets of glands in the neck. They can release hormones which is normally the parathyroid hormone. When released in normal quantities, doesn't cause any problems. But as she said, when there is an imbalance, the homeostasis is disturbed. In those circumstances, that can lead to osteoporosis. Other issues may be like sex hormone deficiency, be it in males when testosterone is less, be it in females, as Dr. Yadav was mentioning, in the postmenopausal state, and even premenopausal when ladies are having premature menopause. In those circumstances, this can be a problem. Other issues may be like vitamin D deficiency and also type 1 diabetes, in which insulin is required for survival, which occurs in young population. When they are having long-standing type 1 diabetes, that can also lead to this. Other issues which are of concern obviously are some blood cancers or leukemias, and the treatment of those conditions by various drugs, they can also cause. Another important thing I need to mention is use of long-term heparin, anticoagulants, and some other drugs. They can also lead to osteoporosis. And being an endocrinologist, I must mention there are some anti-diabetic agents as well, like we mentioned pioglitazone, if they are not judiciously used, can lead to osteoporosis. So these, in summary, tell us the causes of young osteoporosis.
Right. Dr. Chakravarti, if I can take my question to you, at what age should one go for a regular bone density test? What are the tests that are available to diagnose osteoporosis?
So I would go to the second part of your question first, that what are the tests available? The most important screening test for osteoporosis will be a bone density test. It is done by DXA scan. The bone density, though the name is density, which means 3-dimension, but basically it gives an areal density of the bone. With this, we take some images of the hip, spine, and some other regions of the body if required. And according to that, there are some scores built up like T-score, Z-score. Regarding T-score, we categorize the patient as whether they are in the normal zone, in the borderline zone, that is osteopenia zone, or in osteoporotic zone and severe osteoporotic zone. So depending on the T-score, we can actually stamp or label them in which categories they are fitting in. The most important thing to note about this is that this test should be done in the same machine every time, preferably. Other tests available are the QCT, that is the quantitative CT scan, and then bone biopsies are also there, but usually we do not require it because it is an invasive test, and we have some non-invasive good tests available in our armamentarium. Some biochemical tests are also there, but they are not used very rampantly. And as I had mentioned earlier in the previous question, that young osteoporosis patients, they can have a variety of causes for their osteoporosis, so that underlying condition also needs to be investigated. Suppose the parathyroid hormone is raised, that means the parathyroid gland is hyperfunctioning. If the free T4 is raised and TSH is suppressed, it means the thyroid gland is overfunctioning. And in case of type 1 diabetes, obviously the sugars have to be checked well. We have to also see whether vitamin D is deficient or not. So these are the tests available. And regarding the first part of the question, that at what age regular BMD should be done, the thing to be remembered is that though it's a chronic disease, it is not like diabetes or thyroid or some other where we go for a preemptive testing. When the doctor thinks that BMD has to be done, usually it is done once, and then for follow-up it is done at 2 years. But your doctor can actually specify whether this interval can be prolonged, say at 3 or 4 years intervals it is required, or it can be done a little bit earlier as well if the situation so demands. So it will be entirely the discretion of the treating endocrinologist.
Right, thank you for watching. We hope this answered some of your questions on osteoporosis.